Alright, this is Brock. He has volunteered to be my patient today for the adult physical health assessment, the complete health assessment. See, the first thing I'm going to do is meet and greet my patient. Hello, Brock.
Hello.
And then we're going to just perform a general inspection. We're going to look for signs of disease or distress, which he's in no acute distress at present. And then we're just going to assess his basic mobility, posture, build, look for any type of deformities, the way he's dressed, his hygiene and grooming, skincare, his facial expressions, make sure that they are appropriate, his alertness, eye contact, vision, and speech and hearing. So the first thing I'm going to do is the head and the face. I'm going to just inspect his skin, his eyes, his ears, and the skull and make sure that everything is symmetrical and there's no abnormalities. See, we're going to palpate his scalp and his hair. Note the texture. He does have a little bit of thinning and some age-related change as far as distribution and quantity. And let's see, I'm going to palpate the temporomandibular joints. After you close your mouth, here you clench it, open and close. Alright. Now I clench. Alright. You can open it. Let's see. I'm going to palpate the sinus areas. Note any tenderness. He does have a little tenderness in his parotid, so you would actually press that area, which is pretty sore, so see, we're going to test for cranial nerve 5 and 7. I've already had him clench his teeth, so you know you can do that. Puff out your cheeks. Close your eyes tightly. Okay. And wrinkle your forehead and smile. And stick your tongue out. Alright, very good. Okay. We're going to move on. See, we're going to do a little cotton wisp test. Okay. Alright, so just close your eyes for me and you tell me where you feel it, okay? You'll feel this sensation.
On my left arm.
Okay, alright.
Forehead.
Okay.
Cheek. Chin. Right cheek.
Okay. Very good. You can open. Alright. And then we're going to move on to the eyes. We're going to inspect the lids, the brows, the sclera, and external structures. We're going to palpate the lacrimal glands, which Brock does have a little bit of Graves' disease, so he does have a little bit of discharge from the lacrimal glands. Going to inspect the conjunctiva of the eye, and it is pink and moist. And we had done the segment earlier. Use a Rosenbaum chart to inspect his near vision, to inspect his cranial nerve, and also the Snellen chart. We've done that earlier as well, and he was able to do that without a problem. We're going to inspect the pupillary light response. Just close your eyes real tight for me for just a second. Okay. Alright. Okay, and his pupil size is about a 3, and then we're going to check his accommodation. Okay, and his accommodation is normal. Let's see, and then we're going to check your corneal light reflex. Just look straight ahead. Open your eyes real wide, and just check to make sure that the light reflects in the same spot in the eyes, and it does. It's symmetrical in both corneas. If it was not, we would perform the cover and uncover test. We're going to do the extraocular movements. Just follow my finger. Okay. And he is able to do that without a problem. See, that checks for cranial nerves 3, 4, and 5. And then the visual fields test, which we've done earlier.
I have my glasses on.
Okay, we can put your glasses. Just kind of hold this like this. Just tell me whenever you see it come into view, okay? Tell me now.
Alright.
Alright. Can't really. Okay. Alright, so you was able to do that without a problem. And then I don't have an ophthalmoscope, but if I did have an ophthalmoscope, I would test the red reflex and inspect the retina and the optic disc and the retinal vessels, which Brian has a little bit of macular degeneration. Okay, and then we're going to move on to the ears. We're just going to inspect and palpate the ear and the location and the structure of the auricle. And we're going to evaluate his hearing with the whisper test. So if you just turn around, I'm going to stick your finger in your ear and wiggle it. Okay, and turn your chair.
Chicken. Egg.
Okay. Alright, and then you can repeat with the other ear. That is checking for cranial nerve number 8. And then with the otoscope, we would examine the external auditory canal. And then also the tympanic membrane. And it's pearly gray, and you can see the cone of light. Okay. And we can do the Weber test. You hear it equally.
Mm-hmm.
And then the Ren test. Hear it? Okay. So I'm going to stop. Okay. And the bone conduction should be nearly equal to the air conduction. Also, whenever you use the otoscope, you want to pull the pin of the ear up and back, and hold the ophthalmoscope upside down. Let's see, we're going to inspect the nose, the mouth, and the pharynx. Let's see. And for the nose, they actually use a speculum to inspect the turbinates, the nostril, patency. Cover one nostril. Take a deep breath. Okay, now switch to the other one. Okay, and while we're having you do that, let's go ahead and do the smell test here. Oh, I'm sorry. Yeah, check your sense of smell. Yeah, we're gonna check the cranial nerve. Okay. Okay. Sorry. Apologize. Can I let you smell?
Orange.
Okay. And then do the other side.
Lemon.
Okay, very good. Alright, and let's see. Let's move on to the mouth, and we are going to inspect the buccal mucosa. Look in your mouth for me. I have a tiny pressure, so you can take all of it. Say ah. Okay.
Mm-hmm.
Check yep, gag reflex. Checking into the gag reflex, checks cranial nerve number 9 and 10, and so you perform the taste test, stick your tongue out. Tell me if it's salty, sweet, bitter.
Bitter.
Okay. Alright. And then we're going to inspect the neck structures like the thyroid, jugular. Okay. We can palpate the carotid and the jugular vein. We are also going to check the structures for the trachea and for the thyroid. Okay. Alright. And then we're going to check your neck's range of motion with and without resistance. So you head forward, head back as far as you can get it. Side. Side. Okay. And then you're going to push your head against my hand this way. And then push your head against my hand this way. Okay. And then shrug your shoulders. Okay. And we check the cranial nerve 11 whenever we do the shoulder shrug test. We're also going to inspect his lymph nodes. Do the submaxillary, submental, superficial cervical, posterior cervical, and down into the deep cervical chain, and into the supraclavicular nodes. Okay, and then we are also going to auscultate the carotid arteries as well as the thyroid for any type of bruise, and then inspection for enlargements. The bell of the stethoscope. Hold your breath. Hold your breath. Okay. All right, and you breathe. Okay, he's negative for any bruise. Let's see. Upper extremities. Just going to start out with a general observation of his hands, his arms, and his joints and his movement, muscle mass, range of motion. We're going to palpate the radial pulse, palpate the brachial pulse, and then we're going to also inspect the posterior chest. Step forward and turn around a little bit. Turn your chair. There you go. Okay. I'm going to inspect the back for the thoracic shape, the muscle development, the mass, and we're going to inspect and palpate the spine and the scapular regions. And we're going to percuss the spine's processes. Okay. Everything's good there. You just stay right where you're at because your lungs next. All right, and then we are going to observe for an excursion in the respiratory depth, his rhythm, and his pattern. Which his depth, rhythm, pattern are all equal. He has no distress. And his respirations are about 12 to 14. And on the level of the 10th rep, we're going to check for thoracic expansion. Take a deep breath. Okay, blow it out. All right, and we're going to check for tactile firmness and just say 99. Say 99.
99.
Okay.
99.
Okay.
99.
Okay.
99.
All right.
99.
All right, very good. And then we're going to also percuss the posterior and lateral chest wall for any reconnaissance. You can put your hand up behind your hand here. Okay. All right, you put that down. And then we're also going to percuss for the diaphragmatic excursion. We're going to percuss along the scapular line down to the area where we hear dullness. And at the level that we hear dullness, oh, sorry, and then you would actually mark that line, and then you percuss back up to where you hear the dullness again, and then you would measure that area. And actually, by doing it on the right side, is 1 to 2 centimeters higher than the left. And then we are also going to auscultate his breath sounds for any adventitious sounds. Did you beat the breath in and out? Oops. Got to turn it over. Okay, go ahead. Okay. You just want to do that in a side-to-side sweeping motion. Okay. And that concludes. Let's see. That concludes this segment. Thank you.